My role in this, as Amanda had highlighted, we're reviewing the protocol for results to parents, and we thought it was going to be quite an easy project, where in fact it's not really. It is actually very complex. So my brief is to use the user feedback that we've collated to make a new document for healthcare professionals to refer to. The focus is to deliver a high quality service with choice and flexibility for the service users, so listening to that feedback and embedding it into our new guidance. Improve our experience by delivering outcomes in a timely manner, and create a future development for training and the programme as a whole. So we've had some of this already today. We've had breaking the news. One size does not suit all. And I think we all agree that very clearly from the feedback that we've had back from our users. And in terms of us going forward, we can't create a single pathway. We need to create choice and flexibility in the guidance we put out. And as you all explained, you're all using choice and guidance to fit in with families and what they need. But when we do this, we have to remember that there is a limited number of ways we can give results. And that's just a hard fact. So we'll look at those in a minute. The other thing, as I go through some of the feedback and what we've learned from this, is some of this was gathered during the pandemic. It's already been alluded to in one of the other talks. So maybe some of the feedback has been influenced by the pandemic. So it might not be what the normal practice was, because obviously we went through that massive time where services were all changed. But we have to also think within the pandemic, there were some very good changes that went on, and maybe we can take some of that forward as well to bring into current practice. So receiving the news. As we know, service users reported receiving letters, phone calls, attended face-to-face, or had a combination of everything. And that is the way we have to communicate with people. Interestingly, although we went through pandemic, nobody from both groups had actually talked about e-consult, and maybe that's something that could come into a future play for a face-to-face but online. But that wasn't nobody fed back on e-consult, but that was one thing I had used in the pandemic as a screening midwife. So letters, I think we know, people don't like letters, and I think it was our service user, the letter came after the appointment. And that is why letters are very cold. They are factual, but they're very cold. They can take a long time to get to the service user, so how useful is that information? One couple did describe the fear and induced fear and distress of receiving a letter with her results during the pandemic, and this isn't an acceptable way to communicate a life-changing event for her baby. But letters. Are appointments letters? Appointment letters? Is there a difference? Anybody think a letter about an appointment, or is it not a letter? Anyway, as we found out from the service user, they can come late. We did have someone who was absolutely shocked and devastated by an unexpected appointment letter. She hadn't expected it, and when it came, that caused her more distress because she didn't know who to contact, she didn't understand what this was about, and this was part of a pandemic situation as well. So think about if you do have to send out an appointment letter, that does cause its own problems if in fact it actually gets there. If you live where I live, posts come when they come. Phone calls. Lots of us have used phone calls to break screening results or to arrange an appointment. It's a good, positive, personal approach. Service users liked it, to call to arrange an appointment. It gives you an opportunity to build rapport, to gauge knowledge, and to icebreak if you haven't met them before. The downsides are we had a response from a lady who was in Sainsbury's when she received the call. Now, I know from giving antenatal results that people go, yes, I can talk, it's fine, because you don't expect the healthcare professional to ring you. And this poor lady was in Sainsbury's, dropped her basket, ran out in floods of tears. Luckily, the thalassemia, the nurse was close by and said, I'll meet you at home in a couple of minutes, and caught up with her. So people will always say they can talk, and you have to gauge either by the silences, what's going on with them, are they breaking down, are they in a public place? You know, there's a bit of that detective work going on in your mind, although they're telling you, I can take this, I can talk, keep going, I'm fine. Be aware that they might not be in a suitable place to take that. And I'll also say phone calls, if you're not confident or they catch you with unexpected questions, can become a little bit negative. Because people will ask you more and more, and like I think they said, you want to know what's the appointment about, and you're trying to desperately say, can I just arrange to meet you, because you want to contain it, but people will always ask more and more questions. And then the last way that we communicate is face-to-face. So it's the most requested by all the groups and most valued. Everyone, they like the fact that you have dedicated time, ensuring the information is given, where it can be understood, and parents have time to take it in. Many reported feeling comforted and reassured, and one said if they'd been one who came to the appointment had actually, I think we talked about earlier as well, said that she had known the results. A face-to-face appointment is a good follow-up, so she's got time to take that information in and ask questions. But most patients felt that face-to-face is the way to go to give this news. But remember, when you're giving this result, it has to be in friendly, simple language, common denominator. Listen to what they say and feed that back in their own language, because many said at this point in time they're in brain fog, shock, devastated. They can't take in that information. So by listening to the language they use and giving it back can really help get that result over to them. And we've heard those visual cues, different aspects of information given to them. One of the things we did think was that people were shocked and devastated by the results. And maybe we need to go back a stage, because antenatal works well for the newborn blood spots. Is it somewhere that the midwives need to give more time and information about what to expect and how to take that forward? So I'm just going to go. Carrier results, we have spoken about again. Our users did want good counselling and support through carrier results, because these are just as devastating and people didn't understand where it came from, and there's quite a lot of disbelief and stigma around the carrier results. So the bit that really, I think Yamade spoke of this, and Roanna, no news is not always good news. This was a massive part of the feedback. An old expression that actually started in 1616 by James, King James I about evil. Now, we're not saying these are evil results, but we're saying this has been around a long time. It's commonly used and has been since the first parent stories, and certainly when I had children it was used. And I did do a quick poll round colleagues from 3 trusts where I've worked in the last few years, and every single midwife said, oh, I always say no news is good news. And that really is something that it's an ingrained learning. I did ask them why, and they said, that's because my mentors told me. And it's a passed down tradition, so something we need to keep an eye on. It's a phrase used to give hope when there is nothing, to give reassurance when there is nothing actually to say. But it is one of the biggest causes of anxiety for all the groups, and it's something we need to acknowledge as we go forward with our protocol. So what do parents want? They want the results in a timely and culturally sensitive way. We did have a lot of feedback about how long it took to receive the results, and that goes back to maybe the midwife giving expectation and how the process works, how long it would be, and we need to build in a pathway or a feedback mechanism, who they can contact, how they can get results, and how you can get support in that period we're waiting, because parents found that really difficult, not knowing who to contact. When you're receiving, they want health professionals, ensure that the health professionals are fully up to date in their training and are trained to give the results in a suitable way, signposting to reliable results. Making sure when you're given the results, they've got support of someone there. Most parents felt that the clinical nurse specialists were a great source of information and comfort at helping giving out this information to people, and clear lines of support need to be identified. Dr. Google not being a good report. So services, lastly, what we need to provide, we need to give good, clear guidance to our healthcare professionals by updating this reference. We need to ensure that healthcare professionals are adequately equipped with everything we can give them to communicate these results, and have a variety of resources available across multimedia formats to offer parents time and help to digest the information. And then I think Amanda did cover, our future development is looking at the protocol. We'll look at how we give results to carriers, and trusted sites for information, and working with the outreach groups of the societies. And it's a bit quick, sorry.